Hi and welcome to Heal My Hemorrhoids. In this video you will learn how long it takes for a hemorrhoid to shrink, so watch the whole video to the end to get all of the tips you need. Remember to hit the subscribe and like button if this video was of any help for you. If you or someone you know is having hemorrhoids, there's one common question: how long does it take for hemorrhoids to shrink? The answer will be depending on the severity of the condition. Regular hemorrhoids can clear up in a few days with or without specific treatment. Thrombosed hemorrhoids should shrink within 10 days. But for more severe cases, the patients will need to see their doctor solve the problem in no time. Let's have the same common ground first before proceeding. Hemorrhoid is a condition to describe the swollen veins around the lower rectum and anus. It can be external or internal. The internal hemorrhoid type takes place in the inside area of the rectum. Meanwhile, the external hemorrhoids type takes place outside of the anal opening. External hemorrhoids are usually visible. Hemorrhoids are a common condition. So, if you or someone you know are having this problem, there is no need to worry. There are treatments that you can take to manage them. How long will it take to get rid of it? For milder hemorrhoids, your symptoms might end in a few days without treatment. However, the diet and lifestyle changes will speed up your healing process. Eat more fiber items and drink more water to make your stool softer so that it won't hurt your anus. The case will be different if we talk about the prolapsed hemorrhoids. It happens when the internal hemorrhoids become larger from day to day and stick out of the anus. The symptoms are more severe than conventional hemorrhoids. In this case, you will need to add more treatments like over-the-counter ointments. Then you will combine them with home remedies and lifestyle changes. It would take a few days to weeks to get rid of the symptoms. Going to your doctor will help you a lot to speed up the healing. But during the pandemic, it might be challenging to go outside your house for it. Consider consulting with your doctor through online means of communication and have your prescribed medications shipped to your home. Pregnant women are prone to hemorrhoids, especially in the third trimester. It is because of the high pressure in your abdomen which affects the veins in the rectum and anus areas. In the third trimester, it will be a real struggle for most pregnant women because the symptoms won't be away until they give birth. The symptoms that you need to take into consideration. The bowel movement can irritate internal hemorrhoids and cause bleeding. But it will only happen if your stools are too hard. As long as you have a good diet and a healthy lifestyle, it shouldn't be a problem for you. The internal hemorrhoid is pushed outside the anal opening, causing these common symptoms: discomfort, pain, lump, burning, itching and swelling. Those symptoms require immediate solutions so that your hemorrhoids will not be worse than before. Common hemorrhoids are treatable with lifestyle changes. In fact, you don't even need to go to your doctor if you can manage the symptoms by yourself at home. Here are the things that you can do at home. Hemorrhoids can be away faster if you change your diet. Rather than taking fast foods on a daily basis, you can get rid of them for good. Instead, add more high-fiber foods to your diet. Eat more fiber items like fruits, veggies, as well as whole grains. The fiber can affect the stool's absorption of the water, making them softer to ease them to pass during the bowel movement. You will also want to pay attention to your beverage. Basically, any liquid will be good for your bowel movements. But I don't recommend you to consume sugary drinks, soft drinks, or alcohol. The best beverage for you is back to the basic, pure water. Drink at least 8 glasses of water each day to help you relieve the hemorrhoid symptoms. The water can reduce the straining during bowel movements, making the stools pass without having to struggle so hard. Hemorrhoids often happen to folks who sit or stand for too long. You can consider having a routine exercise to help you to relieve the symptoms. You don't have to go to the gym to make it happen. You just need to spare 5 to 10 minutes of free time each day to do an effective exercise. Also, minimize your sitting and standing time. If you think it is too long to sit, you could withdraw and make some stretches. Take a break to drink some coffee or water. Don't hold your bowel movement. If you have the urge to move the bowels, don't hold them. Go to the toilet and move the bowels. Don't delay, because the more you hold, the more pressure you give to your anal and rectum. It will only make the hemorrhoids worse. Change your position when bowel movements. You could change your feet position to change the position of the rectum to ease the bowel movements. If you have a sitz bath at home, you could do sitz bath therapy to soothe the symptoms of hemorrhoids. If you don't have a sitz bath, you could just splash the affected area with lukewarm water to soothe the symptoms. The recommended frequency is 3 to 4 times on a daily basis. Do this for at least 10 minutes for each session. Bathe the anal area whenever you need it. It is also recommended to conduct the ritual each time before sleeping. Soothing your anal area will also help you to have a deep sleep. It is important to take regular showers to keep the anal area clean from any dirt which can make the hemorrhoids worse. Use moist wipes to clean the area of your anus when you are traveling out there. Don't sit for too long to prevent it from getting worse. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. I hope you got help from this video. For more articles and videos go to healmyhemorrhoids.com.